surge will include the new variant originally found in England and that it will happen in 6 to 14 weeks. Well, joining us now to talk about the latest on COVID is virologist and infectious disease expert Dr. Lane Rowland. Dr. Rowland, it's good to see you as always.
Good to see you too, Brittany.
So, Dr. Rowland, we've got the Pfizer, Moderna vaccine, and Johnson & Johnson rolling out soon. Can you tell us more about the breakdown of the vaccines and how each one is created with different materials depending on the manufacturer, but what's used to create them may have a different impact on each person according to their race?
Yeah, that's very important. A lot of people need to understand that each vaccine platform has a different platform in making a vaccine. For example, the Pfizer and the BioNTech is messenger RNA. Moderna's messenger RNA. Johnson & Johnson is live killed attenuated vaccine. And you have COVAX, which is a multi-tope peptide vaccine. So each of these vaccines have the same principle in trying to elicit an immune response where the virus is, replicated in that form, injected into a human being. You have an immune response, and then you're supposed to develop antibodies or neutralizing antibodies to the virus. Each of these platforms are completely different, and there's a learning curve in each of the platforms. In my opinion, when I look at these vaccines and stuff, we're still early in the state of the Moderna and the Pfizer vaccine and eliciting their response. And we still do not know if the vaccines themselves will have what we call long-term affinity maturation. Listening to your previous doctor talk on your previously, he states that trying to have a one dose is better than none. I would disagree with that. The primary dose is always there. Is a primary, but you always have to have a secondary dose to improve the immune system, to improve the antibodies to the actual virus itself.
And yeah, you mentioned you disagree with that. So today, another infectious disease expert who worked with President Biden's transition team said the U.S. needs to rush giving out the first doses, as we just mentioned, before an anticipated Category 5 hurricane-like surge comes. Do you think we're headed in that direction? What do you think about this statement?
Absolutely. I've been talking about this for almost 5 months about the not just the England strain that's going to be very virulent here in the United States. I've also talked about the South African strain. And I've told people before, and people need to understand that we're in the first wave of the second pandemic driven by these new variants. And so these vaccines are very important and part of the solution to the problem. My opinion is that probably of all the vaccines, probably the best vaccine that I've seen is called the COVAX vaccine, which is based off of what we call multi-tope peptide, in which we are making synthetic peptides off the actual receptor of the virus itself, the binding protein, the spike protein, and that gives you what we call the best immune response, both T cells, B cells, and also the ability to make the neutralize the virus and stuff. So we have a long ways to go, and I've told folks that people still need to make sure that they're practicing best biosafety security protocols, because even though some of these folks have gotten vaccines or vaccinations, people still gotten the virus itself, the SARS virus, and folks have also died from this. And so we're going into the next year. It's going to be a very critical year for the world. And so we need to try to have a uniform policy to have not just vaccines. We're talking about testings, and people need to be aware and educated about where we're going with this global pandemic, which is an endemic infection driven by these new viral mutants.
And Doc, in some places, vaccines have run out and sites are having to cancel appointments for people to be able to get them because of the delay. How does that impact those who are waiting to get vaccinated?
Well, Brittany, that's a very good question, because that goes back to what we kind of talked about before, that word herd immunity. If we don't have a uniform policy where we're inoculating everybody on the planet, that's that child in Africa, that's that child in Taiwan. If one person is not vaccinated, we're never going to get to herd immunity. If the population is not exposed to the virus and build up immunity, we're going to always have this SARS-CoV virus in our population, and we're going to continue to be in this global pandemic endemic for the next 50 years. And so we have to have a uniform policy. We have to make sure that the science is vetted. We need to make sure our vaccine programs are based off of medicine and science. We have to have vaccine programs that is inclusive to all different populations, probably one of the biggest disadvantage of the Pfizer vaccine is that when you look at the actual study, the folks they did the vaccine trials were on for all white people from Germany. There were no pediatrics, there were no ethnic minorities, there was no people with disabilities or healthcare disparities. So we're going to have to rev up the science and medicine and get these vaccines into the field and find out if these vaccines really have effective fitness. And one of the problems you see with the AstraZeneca vaccine in Germany, they're not giving it to people over 65 years of age because they have an 8% effectiveness, which is absolutely atrocious.
And Doc, within our last 30 seconds, do you think we're headed in a direction for where there needs to be a lockdown put in place?
Well, when we say lockdown, I think you're absolutely correct about that. That's a very heated word, but we're going to have to get control. And the reason why we're where we're at because we did not have a proper lockdown where people were educated. As long as people are doing what they do, and we can use South Dakota as an example, the Sturgis motorcycle rally, where these folks in up in South Dakota didn't care about masks, and they had 250,000 people over the weekend. All these folks went home. They infected people. They became super spreaders, killing their families, members, and making the virus get. So I believe in the future we're going to have some type of controlled lockdown, and that's going to be to open it back up is when the infection rate goes down. But right now we are wide open, and that's going to be a game changer because I can promise you, in the next 6 to 8 weeks, especially by May, we're going to see numbers of deaths in the world and suffering from the SARS-CoV virus is unimaginable.
Well, we better get prepared. Doc, we thank you so much for your insight. As always, we appreciate your time.
Thank you, Brittany. You have a super fantastic evening. Take care of yourself.
You too.